You're watching Healthbeat, and we're discussing corruption in the healthcare sector. In the private sector alone, this is said to be as much as 28 billion rands a year. It increases the cost of services and it affects how much you pay for your medical aid. With me to discuss this is Botho Mhozya from Discovery Health. Botho, how serious is fraud in the private healthcare sector?
It's estimated that anywhere between 3 to 10% of healthcare spend across the world is attributed to fraud, waste, and abuse. At Discovery, we make recoveries of around 500 million per annum, which represents around 1% of our healthcare claims costs. So the issue is quite a serious one and has a massive and far-reaching impact on healthcare from an affordability perspective, both in South Africa and across the globe.
What's the most common thing that fraudulent people or corrupt people do in the private healthcare sector?
The first one would be what we call card farming. That involves an insured party that takes their medical card and allows their friends or their family to use the same card to get access to medical care. The next one is around what we call ATMing. And essentially what that means is often members would collude with the healthcare provider where the provider submits a claim to Discovery, and then on receipt of payment, the healthcare provider would then split the funds with the member. So we call that ATMing. The other one is submitting false claims. So for services that haven't been rendered, a healthcare professional or a member submits claims for that service, even though the service was never delivered. And then, of course, there's, submitting medical claims where you're disguising, servicing for cosmetic surgery. So somebody undergoing plastic surgery, understanding that it's an exclusion within the medical schemes, but submitting a claim that says, for example, they've had an appendicectomy. Meanwhile, they've had liposuction.
How do you pick it up?
We've got, quite robust systems in place. We've got, world-class analytic capabilities where we are looking at all the claims that we're receiving within a Discovery perspective, looking for outlier trends. We also do have a team of around 44 forensic investigators who are also analyzing and auditing claims. They are supported by an additional 50 people across the businesses, which include coding experts, clinical experts, non-disclosure experts, as well as our team of actuaries and analysts as well.
Can you give me an example? So if I had plastic surgery and I claimed for my appendix that was removed, how do you pick that up? What would that team do to discover this?
Our reports will often look at you relative to your peers. So we would pick up where, certain utilization of codes more than your peers and more than our national benchmarks. And once we've picked up that anomaly, we will then audit the claims and look for suspicious behavior. We will also then engage with the practices once we have a feeling that, there is some untoward behavior. And through auditing of actual, hospital records, so we will ask for theatre records to actually ascertain what happened within that theatre event and all other sort of ancillary claims associated with that medical event, whether it be pharmacy, whether it be hospital records, etc., to kind of paint a holistic bird's eye view of that incident before we can call it fraud.
Once you've caught a fraud, how do you deal with them?
So there's an engagement process where it's an open sort of engagement process with the clinician where we present our findings and we enable them, we give them the ability to be able to provide supporting, evidence around the anomalies or the trends that we're seeing. And if we identify a provider as having been fraudulent, there's then a legal process that takes place. If it's blatant fraud, ATMing, card farming, etc., those examples that I gave you, we do also have a responsibility to report them to the HPCSA, report them also to the South African Police Services. And parallel to that process, there's then an acknowledgement of debt, where the provider does kind of, acknowledge that they were, engaging in fraudulent or wasteful behavior, and then there's a payment process that's put into place. We have a zero tolerance when it comes to fraud. All monies that are recovered through these processes of forensic investigations go back into the trust that holds the members' funds as the custodians of the medical aids.
Can you give me an example of a recent discovery that you made of fraud and how that played out?
We deal with quite a few on a monthly basis. But it's the recent one would be a syndicate where it's both member and provider collusion, both involved, working across multiple practices. In that instance, our analytics are able to quite quickly pick up the relationship between those practices and the members that are involved.
Now, so many people in the country are so concerned that the NHI fund will be a really big pot of money that would be open to corruption and abuse. So what kind of rules would you like to see in place to prevent that from happening? What tips can you give?
I think it's important to note that fraud exists across all industries, whether public or private. And so you need robust processes in place to be able to detect fraud in a timeous manner, and then obviously processes in place to be able to recover those funds on behalf of the NHI fund as well. So it's a team of experts in the discovery ecosystem. As I've mentioned, we've got our forensic investigators, we've got our clinical team, we've got our coding specialists, we've also got our team of actuaries and analysts as well, working hand in hand to be able to detect fraud. So you would expect a similar composition of skills to be able to detect fraud within the NHA fund.
If you didn't have these measures in place to detect corruption and fraud, how much more would premiums have been?
So if we didn't recover on behalf of our members, our premiums would actually be 14% higher than what they are today. So as a direct impact of the work that we do on fraud, we've managed to keep contributions 14% lower than what they would be if we didn't have those processes in place.
Botho, Mhozya, thanks very much for sharing your insights. After the break, we look at how the NHI fund will prevent fraud and corruption, if at all.